Hello, everyone.
Hi there.
Just wait another minute or two, then we can get started. I see a few names I recognize out there. That's good. I hope everyone's enjoying this lovely, warm, hot weather. Maybe some of you are not. I am enjoying it immensely.
Yes, I love it. Love it.
Oh no, Aaron said they're currently in the middle of a tornado warning, bad storms. Well, I hope they move quickly through, Aaron, and nothing happens. I hate seeing those red pictures on the weather map. Okay, well, why don't we get started? I'd like to welcome you all tonight to the PSNA Town Hall. We did this at the end of April, I was gonna say August, at the end of April in the morning. So we thought we'd do an afternoon, evening one for those of you who work during the day and couldn't attend. Keeping the same format. We have a few slides up here, and at the end, we'll open it up for questions and comments. So welcome. Okay, Dana. So tonight we'll talk about on the agenda a legislative update. We'll talk about the Patient Safety Act, CNO of the Commonwealth, and the Nurse Licensure Compact. And then upcoming events, we'll talk about our Coffee and Connect series, our STAR Leadership Program, and our annual summit, which is coming up in September. And I just want to do a little disclaimer right now. We do have a pool that they put a new liner in today, and they brought half the water to fill the pool, and the truck is out there and is very loud as far as I'm concerned. So if you hear a truck out there, it's because they're dumping thousands of gallons of water into my pool while we're doing this, because that's how it's going to work tonight. Okay, next slide, please. Okay, so in February of this year, Wayne Reich joined as CEO of PSNA. Wayne has extensive experience with PSNA. He was the deputy CEO in the past, treasurer on the board of directors, chair of the bylaws committee, chair of the policy committee. And he's been very busy, very, very busy since he came on board in February, and leading the association and meeting its goals and advocating and education and just connecting with nurses across Pennsylvania. So I'd like to invite Wayne to provide an update on your first few months in office. Wayne.
Thank you, Deb. As you had mentioned, it's been a very busy 3.5 months so far. I spent it getting to know the staff, updating our staff IT technology, conducting interviews and hiring a government affairs specialist who's joined us on the call, Tom Doherty, butchered that, sorry, Tom, whose first day was yesterday, yes. I've been spending a lot of time meeting with our safe staffing partners, making sure we're still keeping pressure on our legislators, making sure that's still moving, and also connecting with our PSNA committees, as well as many other updates that President Cardenas will talk about soon.
All right, thank you, Wayne. Welcome, Tom. Okay, Dana, next slide, please. So as far as the Patient Safety Act goes, this is House Bill 106, Senate Bill 240. This bill amends the Act of July 19th, 1976, known as the Healthcare Facilities Act, and this provides for hospital patient protection. The prime sponsors were Senator Maria Collette in the Senate, and then Representative Tom Mahaffey in the House, and Representative Casey Tomlinson in the House as well. So what you'll want to know about this bill, in case you haven't read through it, but you can read through it if you go out to the website. There's a link to click on, learn more, like it says here. It ensures the health and welfare of Pennsylvania citizens. It talks about having like mandatory direct care professional nursing practice standards and professional practice protection for our nursing care in the interest of our patients. It talks about competent, safe, and effective professional nursing care, having uniform, minimum, numerical, and specific RN to patient staffing ratios that will improve our patient outcomes. It will also include tools as far as a patient classification or an acuity scale. Maybe you've worked with those in the past at other facilities. That's going to validate and monitor that patient and family care responsibility or requirements, excuse me. The nurse to patient ratios are identified by specialty area.
Thank you.
And I have a few, I just have them written down, so I apologize for reading this. So having one-to-one patients, there'll be those patients who are receiving conscious sedation, critical trauma patients in the emergency department, prenatal services such as labor and delivery, if you're in the initiation of an epidural, and circulation during a C-section would be one-to-one, and those unstable newborns and critical patients in the resuscitation period will be one-to-ones. 1 to 2 recommendations were for the intensive care unit, critical care unit, NICU, burn unit, critical care patients that are in the ED, and those in the immediate postpartum period. The intermediate care unit for the 1 to 3 ratio is your IMCU, your step down, your antepartum patients who are not in active labor, mother baby couplets, pediatrics, and telemetry for the 1 to 3 ratio. When we look at 1 to 4 ratio, those are for emergency department nursing staff, although the preference is less than 4. Postpartum women or post-surgical GYN patients, those patients in the psychiatric units, med-surg units, pre-surgical units, admissions unit, or then an ambulatory surgery unit. And then 1 to 5 on the rehabilitation or a skilled nursing unit. If the facilities would violate the act, it would result in fines. But what we want you to know is that a significant amount of work has gone into this bill. Like Wayne mentioned, meeting with legislators, PSNA has had this legislation in effect for many, many years. And so have the other nursing organizations across Pennsylvania, like SEIU, PSNA, and other facilities. And what happened is, if we go to talk to legislators, they would be confused about which bill we were actually talking about, because all the separate nursing groups had different things. So we decided to pull together with the group and collaborate on one bill to be able to pass this legislation so we can have safe staffing ratios for our patients. So I'm proud to say that, again, these groups have met with members of the both Democrats and Republicans. We've had legislative breakfasts and legislative events in Harrisburg. There's been virtual and in-person press conferences. We've been featured on various media outlets to bring awareness to this important topic. And again, please know that we'll continue to advocate for safe staffing legislation for Pennsylvania nurses, and we hope you'll join our efforts. Okay, next slide, please. The Chief Nursing Officer of the Commonwealth. Essentially, for decades, nurses in Pennsylvania have been severely underrepresented in the underrepresented state government. We are the largest segment of healthcare providers in Pennsylvania, but we're not considered full partners with other professionals in shaping our healthcare. So House Bill 953 or Senate Bill 848 is going to do that. So the CNO of the Commonwealth The intent is to advise the governor and other leaders on health policy, coordinate programs to promote wellness, public health, and nursing issues, review professional practice standards in public health, and consult with national experts on healthcare research, innovation, and development. As we remember the beginning of COVID-19, every day we had the update on how many COVID patients we had, what the PPE status was like, did we need ventilators, et cetera. And, we didn't have a nurse representing us at the state level. But just last week, this bill passed the Senate. So that was awesome. So now the bill has gone to the House of Representatives. So we will await further information to see the progress from the House. So that's very exciting news. So we're anxious to see what happens next. Okay, next slide, please. The Nurse Licensure Compact that did pass. This was Act 68 of 2021. It was Senate Bill 115. This was signed into law of July 1st of 2021. So this authorized Pennsylvania to join the Nurse Licensure Compact. And then once fully implemented, this compact will allow RNs and LPNs to have a multi-state license. So you can live in Pennsylvania, but you can practice in another state as part of the compact. You don't have to purchase 2 licenses. You just have to pay for your Pennsylvania license and you'll be able to practice in the other states. It is still, the logistical section is, portion is still going on, and it remains with the State Board of Nursing. So progress is expected this year. So more, as we move more into the year, we expect to see more information. But everyone, when I see people out in the community or at work, everyone's very interested in learning more about this. So more to come. Okay. Some upcoming events. Dana Shive, she was in the beginning, if you noticed her, she's our Director of Communications, and she has started something called Coffee and Connects. So if you've had an opportunity to attend these, they're awesome, and they're held usually monthly from 3:30 to 4:30 on different topics. And we are giving continuing education credits for it. They're always very interesting topics. June 23rd is our next one at 3:30, and that will be on gender identity. And then July 27th, the topic will be patient safety events, occurrence, reduction, and management. This speaker for the patient safety events will be from the Pennsylvania Patient Safety Authority. So anxious to hear both speakers at our Coffee and Connects. It's a great topic, and you'll get a lot of good information. Our Star Leadership Institute, apply today for that because it will begin in September of this year. So September 22nd, 2022 will be virtual. And then in April, there will be an in-person session at the Historic Hotel in Bethlehem. So more to come on that. And please apply for these programs. I've heard nothing but good reviews about the Star Leadership Institute. I had never attended before, but it's very valuable information. In September, we will have our annual summit, and more information will be coming soon on that for the date and what the topics will be for that as well. Okay, Dana. Okay. Nurses Week. We had a very, very busy Nurses Week this year, which was great. We had many giveaways. Dana was very successful and being able to contact various facilities and institutions, and we were awarding giveaways. Penn State Health Lancaster Medical Center had a meet and greet at Altana in Lancaster. I had the privilege to provide a keynote address on the future of nursing, roles and opportunities for nurses in academia and clinical practice at a conference in Hershey that week. And then ending the week on May 13th was a live webinar on hospital culture, legal requirements, patient safety, and practicing safely in Pennsylvania. And we had two attorneys, Ben Post of Post and Post, and Kathy Burke, who's a nurse attorney, speak to us about these topics in light of the Redonda Vought trial. And actually the day of the webinar was the day that the sentencing came in, but the sentencing came in after the webinar was presented. We got a lot of great feedback on this. We feel that it's very important that we're providing good information for all of you on how to practice safely. So with this, and then, having the Pennsylvania Patient Safety Authority staff person present at the Coffee and Connect at the end of July, keeping that thread of helping our nurses in Pennsylvania practice safely. Okay, if you can go to the next slide, Dana, please. Okay, the Nursing Foundation of Pennsylvania, also during that week, May 11th, we were at the Valeska Jewelers in Lancaster, Pennsylvania. And anybody who purchased anything from the jewelry store that day, they took 20% of the purchases of what was purchased during the day and donated it to the Nursing Foundation of Pennsylvania to ensure nurses for tomorrow. These provide nursing scholarships that we offer once per year. Catherine, who is the owner and designer, also worked with us to design a necklace, and that's a few slides later, but we'll get into that. We also have something where we want you to share your recipes. And there's going to be a book called The Hungry Nurse, and it will be available to order in fall of this year. So we wanted to get your favorite recipes to include in our cookbook. It's always fun to try new recipes. So please consider, providing a recipe for us and sharing it. Okay. Yeah. Okay. Thank you. Our online education. We are a state approved provider of the mandatory child abuse recognition education. It is free to members, and for non-members, it's $35 to complete it and to get your CEs. This is every 2 years we have to do that when we're renewing our licenses. And then also there are other state approved courses for Pennsylvania practitioners that you can attend online and get CEs for as well. So we are currently having our CE center is currently under construction. But again, you're still able to take the sessions with not having a cost to them as long as you're a member. And if you have difficulty accessing it, then just send a message to PSNA and we'll help you to get access to it. And I know sometimes they'll send a code out. Here's the code to use for your education. So and you can email Dana, dshive@psna.org. Okay. The LPN membership update. So at our annual meeting last year in September, there was a change to the PSNA bylaws that allowed Pennsylvania LPNs to be state-only members. So of our association. So the staff at PSNA are diligently working hard to set up this process for LPNs to join. So we are still in process of getting it all set up, but more to come on that, and we'll let you know more about that as well. Okay. Okay. Are you interested in participating in PSNA, whether it be at a committee level or at the board level? These are the current openings for the board. So there's the president level. Level 5 is informed and ready to lead. The treasurer level is a level 4, a board member level 4. YNPs are young nurse professional board member. That's at a level 3. We're looking at our barometer here. The American Nurses Association representative, where you can attend a membership assembly or attend any kind of virtual ANA membership events that we have going on. You can be part of the practice council, which is level 2. The nominating committee is level 1, innovation funds level 1. And we look at level 1, it's involved and ready to learn more. So, what is your experience level? Are you just starting out? You're just not sure what, if you want to participate, maybe you want to apply for something that's like a level 1 or level 2. Applications, you can find out more information about what each, position is for online, and then you submit an application, and then by June 10th, and once you submit the application, probably around July and August, there'll be voting by the membership, and then the winners will be announced at the annual summit meeting in September. So if you're interested, again, it lists like what the your volunteer responsibilities are, and what what that information would entail. Okay. I mentioned earlier, Catherine from Valesco Jewelers worked with PSNA and the Nursing Foundation of Pennsylvania to design this sterling silver stethoscope necklace. You can adjust it, I don't have mine on, I should, from 16 to 18-inch length. It's a beautiful piece of jewelry. I do wear it a lot. It is $85, which includes shipping and handling. Again, sterling silver. All proceeds support nurses in Pennsylvania. You can order it at www.thenfp.org. So it accepts PayPal and credit cards. You can do that, and you will get that sent to you. So if you know anybody that, maybe even a graduate, maybe someone's just going to nursing school, you would like it for yourself, treat yourself to a nice sterling piece of jewelry. It's a great opportunity because it raises funds for the Nursing Foundation scholarships. Save the date for November 5th, 2022. Our Black and Gold Gala is back. We have not had it for the last 2 years because of COVID. We'd had it previously for the 2 years previously. You get to get dressed up in all your finery. And this year it's going to be a masquerade ball. I've never been to a masquerade ball before, so I'm looking forward to this. It'll be at the Hershey Country Club, and more to come as we get closer to that. But they're the first 2 that were held. I attended, and I really had a great time. So hope to see you at the masquerade ball. Okay. Before we get to questions and answers, we're always looking for suggestions for educational opportunities, activities that you're interested in hearing more about, learning more about. So please let us know what you're interested in, and we'll see how we can work that on our, into our offerings as well. And I do want to thank you for your dedication to your patients, your families, their families, and the community. And thank you for everything that you do. And please take time out for yourself to do some self-care, because it is important. You may put yourself on the back burner all the time, but you do need to take some time for yourself. So please be sure to take some time for yourself. Okay. All right, now we will open up to questions, and there's a lot going on in the chat when I was talking, so let me see if I can see what's on the chat. Okay, Dana posted the STAR leadership link. You can just click on that if you're interested in applying for that or just learning more about it. There were CMEs that were CE, continuing education units for nursing, that were awarded for the event. Any questions, you can reach out to Dana, and she had her email address there. The levels, as I mentioned, they were based on the level of interest, the level of experience that you have. where you feel like you might fit in on that barometer, if you will, to volunteer. And you would have to go out to the consent to serve form, and the link is also in the chat. An example, trauma-informed care as an educational topic. Great topic. And there's the link to order your necklace. And Teresa said, great idea on the trauma-informed care. Okay. All right, Dana, do you want to stop sharing, please? Okay, now I can see everybody. So questions, comments, other recommendations for other activities or educational opportunities?
I
Teresa.
do have a question about the Patient Safety Acts, the House Bill 106 and Senate Bill 240. Excuse me. So they are identical. I mean, literally word for word when you compare them, because I needed to do that for class. They're identical. So are they just, I don't understand this part of the legislative process when there's two identical bills. Are they just trying to see who gets it through? I mean, if they both started identical bills, you would think that, okay, well, then you're going to accept it because you both put it out there, or, you know, but do we just try to see who wins the race first, or how does that work?
Hey, you know what? Almost exactly like how you said it. So whenever we introduce legislation, we like to do dual bills in each house of the, one in the Senate, one in the House, just to see sometimes one will pick up quicker than the other. So we can push there. Also, like you said, if one passes and it goes to the other chamber, a lot of times it'll be very similar or almost the same bill, if, unless there's any amendments to it. So it is easier to pass that way. So it is kind of a way that we cover all of our bases because we have to introduce legislation every 2 years. So you never quite know where it might move or how it might move. So we want to be prepared in both places.
Thank you. Second part of the question. So, and I think you alluded to this, Dr. Cardenas, is that so the committees within the hospitals is a dead in the water approach. So as you said, moving together, so ratios will be the way that we're going to move forward, try to move forward in Pennsylvania. Is that true?
That we have that, yeah. But it's really looking at the standards of care. Like, we didn't just pick these out of the air and say, okay, this is going to be, we're putting this ratio here. What are the standards of care for those critical care patients, for those labor and delivery, for trauma, for med surg, for rehabilitation patients? Like, what does the evidence say? The standards for the specialties say. So we utilize that information, and we would want them to have the nursing staff to have those standards when they go into work and care for those patients. Yes.
So
Okay, because I know that we talked about before that for smaller hospitals, that may very well be a significant challenge. And that's why the bill with the committees by the hospitals, that was the defense for having that, so that different size hospitals, acute care settings could be able to realistically monitor that. So that doesn't change. I guess that'll just be something that will have to be worked out by those hospitals. Not sure what the approach is on that.
Yep. So in an ideal world, so I helped write the bill in 2008 with the committees. We pushed it for a very long time. We really got nowhere at the hospital association. Recent research has shown that ratios are better than what we originally had first assumed. Things are working out in California better than what we thought they would. So a couple of things with that. It was a very hard process for me to change from committees to ratios, because I do firmly believe in an ideal world, those bedside nurses have the best idea of how their unit should be staffed. Unfortunately, we don't live in an ideal world. And I've heard too many times from too many nurses saying that they don't believe that their hospital would be fair in those committees. So we did, we approached we went together with SEIU, PSNAP in coming together on a bill that met all of our criteria together. So we are stronger together. I think this is the first time in history where all three of our associations have worked together on one piece of legislation. And I do think it's a strong piece of legislation. We do understand though, where the ideal is here, we're kind of maybe even down here a little bit. So one of the ways that we've worked around that is we take a stepped approach to it. So when the ratios go into effect, they don't go from the wild, wild west to two nurses or two patients to one nurse. It'll be a staged approach. We also saw in California that when they enacted ratios, nurses came from other states quickly. And so we do believe that if we enact this bill, we'll see nurses come from out of state. We'll see nurses who left the bedside return to the bedside as well. So I think there's a couple of things there where that will help offset that with the smaller hospitals.
Thank you.
You're welcome.
And like I said before, I remember going to the state capitol and talking to legislators and they're, they were very confused about who are you and what does your bill say? And, I think this is more cohesive and collaborative so that we're all saying the same thing. Okay. All right. Thank you. Thank you, Wayne.
Yep. Marilyn, you're on mute.
Just today, I had a question from a nurse friend about her license renewal. And can you update us what's going on with the state board? My license is due in October. Should I apply now?
Oh, well, they had the legislators tasked the State Board of Nursing with delving into the reasons and rationale of why there were such delays. So if you go out to the website, you'll say, oh, I'm an experienced nurse and to renew my license, so I should get it in 3 business days. That's not necessarily happening, okay? And the new graduates, are new who haven't even taken their boards yet, it's taking them, they say probably about 7 to 12 weeks. It's taking much longer for our new, person to be newly licensed. So they had a list of what the rationales were, why there were holdups there, and I think they're tasking them to start working on them. And I'm not sure, Wayne, do you know if they put any kind of deadline on anything about when they have to have action plans in or anything like that?
So the report came out just at the end of April that the Joint Legislative Committee conducted. They pointed out several legislative fixes that they believe would be appropriate. And I haven't had time to tell Deb this yet, but we just found out yesterday that there is a co-sponsor memo circulating in is it the House or Senate, Tom, with some of those legislative changes ready to go, that they're going to work on that. So the hope is what the committee or what the investigation found was they're understaffed. Some of the processes are duplicative. The PALS system that the state spent millions of dollars on, the computer system that they use, doesn't work with anything else, is causing all kinds of problems and slowdowns. And in fact, that's one of the reasons why the nurse licensure compact hasn't moved yet. The State Board of Nursing just found out last week that the FBI denied them once again in the background check. So what's really holding up the license compact right now is the fact of the background checks by the FBI. The system that the board uses isn't compatible with the FBI system. So something that's so simple in other states, we're having problems with because of outdated systems. So there's some talk about replacing those with, instead of a home built system like we have, with a commercial system that maybe other states use. So there are fixes on the way. I can't tell you how fast that will work. What I would tell you though is you can do your child abuse education, I believe, up to 6 months before the deadline. But as soon as you get and do it through PSNA, because we do submit those every day. And then also, and members get to do it for free. And also, as soon as you get renewal from the board, I would highly recommend processing it right away to make sure that you're early in the queue. Times have been better than what they were in December, but they're still slower than what they should be.
And just to tag on with what you said, Wayne, so PSNA will submit the child abuse education information on a daily basis, whereas other facilities may batch them and send, and they wait a week or two. So if you're frantically realizing that it's October 30th and your license is, due tomorrow, your renewal's due tomorrow, and you're doing your child abuse education today, if you don't have that child abuse education, they're not going to process it. So you want to give yourself enough time to make sure that has already, to give that maybe 2-week period of time. Or if you do it again, PSNA for free on a daily basis, we're sending it during the week, then you'll know that it's there. But sometimes nurses just kind of wait to the last minute and don't realize that there is that delay. They think it goes automatically. So keep that in mind. I see in the chat that Molly said she'd love to have an online journal club, 1 article a month tops. I know did we have, Wayne, were we having a journal club before, or just?
Yes,
have
there
that?
will be a book club in the fall. So we are actually going through the process of deciding what book we're going to go with. So if there is a book related to nursing practice, send some ideas to Dana. We'd love to take a look at those. I think we are going to try to avoid anything related to COVID, just to get a break from that. But we're looking at and those are usually great conversations that we have with the book club. I think we could take a look at a journal club as well.
Great ideas, yeah. And Karen said your first town hall, and thank you for coming. And you're new to the bylaws committee, so we're excited to have you attend the committee and learn and grow and do. So thank you for volunteering. We're very excited. And like I said, if anyone else is interested in participating on a committee or consent to serve, go out to the website and look at the various descriptions of the committee or board position. Any other comments, questions, suggestions?
I just wanted to say how encouraging it is to hear about the evidence coming out of California, and that California, because of the ratios, that'd be such a benefit for nurses in Pennsylvania if we're able to set the same climate.
Yeah. Thank you.
Let me just ask you a logistical question. Is having, does this time in the evening work for you to have an evening town hall, or is there a better time? Is the morning better? We did it not at 8 a.m. for the morning session at the end of April. So we tried to, like I said, wait about a month to do it in the evening. We try to figure if people work till 7A or 7P, maybe get some time to give report and jump on the call if they were interested in doing that. So do different times of the day work? Okay, a few people said it was a good time. That's good to hear. Good. We're interested in what you have to say. Feel free to, email Dana or Wayne. My email does not work well. I get it sporadically, even though it's been a couple of times we've worked on this. So I would offer my email, but I can't guarantee I can get back to you. So Dana or Wayne or the PSNA email itself, this PSNA, what is the main one, Dana? PSNA.org. There's an email. You can send a suggestion there.
PA nurses at psna.org.
Okay. All right.
I put it in the chat.
Thank you.
Thank you.
Because I've gotten emails forwarded to me from there, so I do respond. I am interested in what you have to say. Oh, and I think Teresa put Antidote to Suffering. So as one of the book choices, right, Teresa?
She's a nurse. She's the CNO for PSNA. I think it's a fascinating book. I think it can be one of those love-hate books though. But I think she uses a lot of good evidence and offers great examples of how nurses unintentionally extend the suffering of patients and families and what we could do about it.
Very interesting.
Yeah, I'll have to take a look at that. One other item, if you go out to the PSNA website, if you want to do our phone to action, where you can type in your email address and your address, and that'll attach to your legislator. So if you want to send an email about safe staffing or about another issue, full practice authority in Pennsylvania, something like that, you can do that, and it's an automatic email that gets sent to your legislator. And I've done that a few times, and my legislator actually responded back to me and told me why he was going to support or not support, or at the time what the issues were. So that's a great opportunity to also connect with your legislator if you're not certain on how to talk with them. You know, that use our call to action, phone to action. And Dana put the link there for you, psna.org/advocacy. Tom put a book in there, A Farewell to Arms, Nursing During Wartime. Awesome.
I need to
Your favorite book.
expand my repertoire a little bit. So
Great. Thank you.
It's Marilyn again. Another one is We Band of Angels to the nurses in the Navy and an Army or so in Bataan during World War II.
And what is it, Marilyn?
We Band of Angels, Elizabeth Norman.
Oh, okay, band. Okay. Thank you. Great suggestions. I'm writing them all down. So. And how often would you want to have a town hall? Like twice a year, quarterly? What would work in your schedules to attend? Quarterly. Okay. Does anyone have any other comments, questions? Okay, well, we'd like to thank you for attending tonight. I'm very excited that you attended, and thank you for your participation. Again, thank you for all that you do every day with your patients, their families, your community, and remember, do some self-care for yourselves.
Thank you, everyone.
Good
Have a
night.
great evening.
thank you.
Thanks, everyone.